much. Thank you so much, Chairman Wyden and Ranking Member Crapo, for this hearing. I want to echo what Senator Warner was just talking about when it comes to facilitating medication-assisted treatment, and I look forward to working with colleagues on both sides of the aisle on that. And before I get to my questions, I also want to reinforce my colleagues' calls to continue to expand telehealth access, including in rural communities. The dramatic expansion in telehealth services during the pandemic has benefited a large number of patients, including in my home state of New Hampshire. I want to turn now to Dr. Davis. The news that there could be an authorized COVID-19 vaccine for all children by the end of this year is truly an exciting development for many families. However, I'm very concerned that over the past year, routine child wellness visits and pediatric vaccinations have declined significantly, particularly for children enrolled in Medicaid and the Children's Health Insurance Program. Telehealth expansions have improved access to many routine primary care services, but unfortunately, you can't get a vaccination over Zoom. So, Dr. Davis, as telehealth becomes more integrated into primary care services, how can we ensure that children will continue to attend routine in-person wellness visits that help ensure that children are receiving life-saving vaccinations, as well as critical developmental and physical screenings? And how do we get children who missed their routine vaccinations over the past year back on track?
Thank you, Senator Hassan. Yes, it's very important. And I do worry about the kids who are delayed in their vaccines because of hesitancy in going into care. But I have seen the resilience in our family physicians, our pediatricians, especially at our community health centers, in getting creative and innovative in making sure that kids are getting their vaccines in terms of, drive-up clinics, parking lot operations, and being able to make sure that they are getting them. I'm not worried that telehealth is going to replace what we do as a physician, and in combination in that primary care relationship, doctors are going to make sure that their kids are coming in for their vaccines and have really seen them being stalwarts and champions in continuing that. I think that there are other things that we can do to encourage vaccines, requirements that happens at schools, to make sure that kids are getting the vaccines. But I'm not worried that there's lots of catch up to do, but I think that we can get there.
Thank you so much for that. To Dr. DeSherry, I want to talk with you a little bit about home and community-based services. The American Rescue Plan increases federal funding for home and community-based Medicaid services. However, while this initial investment is an important step, we need to do more to ensure that older adults and individuals with disabilities have access to this care. Many of us on the committee are continuing to work towards some long-term solutions here, but what changes do you believe are needed to expand the home health workforce and improve the quality and accessibility of home and community-based services?
Thank you so much for this question. We can't, in geriatrics, we can't do what we do without the family support, without the aides who are there to care for our patients. Almost our work is like 1/10 of the daily work that these people do to help support our patients. And it's so important that we're able to support the caregivers. So I agree with you that we need to think about how to expand that workforce, how to make sure that patients are able to get high quality care through that workforce. And it could be through family caregivers or paid caregivers.
Thank you. Is it fair to say that families who can get some support and relief from home care health aides, for instance, often are able to support their loved one better at home than when they try to do it all by themselves?
Yes, definitely.
Thank you. To Dr. Davis, one more question. The COVID-19 pandemic has demonstrated the value of providing critical vaccines to vulnerable populations at no cost. Women covered through Medicaid are less likely to receive their tetanus and influenza vaccines during pregnancy than those who have commercial insurance. Earlier this year, Senator Cassidy and I reintroduced the Maternal Immunization Coverage Act to help address this disparity. This is a bipartisan bill that would ensure that state Medicaid programs cover ACIP-recommended vaccines for pregnant beneficiaries at no cost. Dr. Davis, How should we apply the lessons that we've learned from this public health emergency about the benefits of providing vaccines to vulnerable populations at no cost in order to ensure that all Americans have access to life-saving vaccinations?
You know, we've really learned from the COVID-19 vaccination that when you are able to offer it without cost, then that removes a significant barrier. And the AAFP agrees that we should expand access to all ACIP recommended vaccines at no cost through Medicare, Medicaid, CHIP, and all other commercial insurers.
Thank you very much. And thank you, Senator Crapo.